I want everybody to please be aware that we are being recorded for broadcasts. So please remember to turn your microphone on when you are speaking. It's a little button in front of you. Many of you are familiar with it, some of you may not be. But more importantly, when you are finished, make sure you turn your microphone off. Take it from experience that sometimes we say things when we think the microphone's off that end up across the state of Connecticut that we wish we never said. So be very careful with your microphones, okay? First of all, let me start by thanking everyone, Jimmy, for coming here today. I think this is going to be a very exciting opportunity for us to resolve an existing problem. I just talked to a reporter, and I talked about Con-Pace and Husky and how historic they were and what wonderful programs they are. But as I look at the faces around this table, we also know that it's a yearly struggle to have to fight for the dollars for Con-Pace, fight for the dollars for Husky. Sometimes it gets partisan, sometimes it's bipartisan, but we always get into that situation of, of butting heads when it comes to coverage, accessibility, and affordability on those programs. They are wonderful programs, so what we're trying to accomplish here today is, I hope, something that is more sustainable. In my own opinion, and we're going to be asking everybody's opinion, I would like to see some sort of public-private venture, if it's feasible, because that way we can have something that is sustainable economically, that we don't have to worry 5 years from now will the program exist, something that is, as I said earlier, thinking out of the box. I've had some conversations with many of you in this room over the last few years, and there's some great ideas out there. And what I also want you all to remember is respect for one another. Now, we have some very diverse opinions around this table, and I did that for a reason, because I think everybody has part of their idea, if not all their idea, is worth listening to. So we should share those ideas. If we disagree with them, it's okay. We're going to probably disagree on a lot of stuff over the next, how long this may take. But please respect one another's opinion. So if you hear something that you don't agree with, fine, let's debate it, let's talk about it. More so, we're trying to find a solution. That's the most important thing, is always keep the one thing we're trying to keep on. Is there a way to take care of the kids of Connecticut? Is there a way that, like that young gentleman, 6 years old, that's just a poor innocent kid trying to get a tooth fix, thinking his family has Husky and gets denied? In my opinion, that should not be happening in the state of Connecticut. As many of the folks around this room, some that are advocates with the healthcare industry or managed care industry, I hate to have to pick up the phone and call and say, geez, can you help? Can we fight for this person? It's a very difficult thing to do. It's difficult for families. Hopefully, we're going to come up with a new plan that's going to be able to resolve some of these problems. Again, with the intellect around this room, I believe we can do something that is outstanding. So with that, what I'd like to do, I'm going to go to you, Amann, first. We're going to go right around the table, and here's what I want. Of course, state who you are, who you represent, and if you have any thought to add today. This is strictly an organizational meeting, and I'll start with you, and we'll go around the table. And again, thank you, everybody. I really appreciate you being here.
Thank you, Mr. Speaker. My name is Juan Figueroa, and I'm the president of the Universal Healthcare Foundation. And first of all, let me congratulate you, Mr. Speaker, for taking the leadership on what is a critical issue for children here in the state of Connecticut and for many working families throughout the state, as well as the country. The Universal Healthcare Foundation, our mission is in essence to have the state of Connecticut achieve a universal healthcare system where everyone in this state can have affordable, quality medical care. Towards that end, we are funding a series of programs dealing with small businesses, community healthcare centers, and advocates, generally speaking. One thought that comes to mind through you, Mr. Speaker, that I think as I hear the presentations this morning, and as I think as a committee we ought to think about and entertain, is really understanding as a matter of first instance what our healthcare expenditures are all about. Having or making sure that we as a committee understand where is it that we're spending our healthcare dollars. Where is the potential waste? Where are the potential opportunities? Where can we perhaps do some shifting, even if it's, once we entertain the politics of it, becomes whatever the case may be. So I think that as a matter of starting out the work organizationally, I would propose that that we see it, that we have accurate and complete information about what is it that the state of Connecticut spends on our healthcare dollars. I may add, it's the foundation is actually involved right now and has commissioned a group of experts from the country, from MIT Urban Institute and the Economic Social Research Institute, to actually look at our healthcare expenditures, look at how much we spend on the uninsured, and I think it's looking at that kind of information by objective experts that can give us some kind of grounding for being able to start looking at ways in which we can achieve covering all the children in this state.
Good morning, Mr. Speaker. Thank you for inviting me. I'm Monette Goodrich with the Connecticut Health Foundation. I'm sitting in place of my boss, Patricia Baker, President and CEO. I think this is a very large undertaking, and I appreciate everyone being here. While I don't have a magic bullet solution to this problem, and I wish I did, I just want to bring up some issues that I think the committee should consider during our deliberations today and in the future. As you already indicated, Mr. Speaker, oral health is an issue that I think gets passed over quite frequently. People do not think of it as a medical health problem. They look at it as cosmetic, and it is tooth decay and dental caries is the #1 most curable disease that affects children here in Connecticut and across the nation. I'd also like to point out that another one of our priority areas at the foundation is children's mental health, and I think these services, especially for children with severe emotional disturbances, don't necessarily have access to the kind of treatment they need, whether they have Husky or private insurance. I'd also like to point out that while we're discussing children who are uninsured, I also like to point out that racial and ethnic health disparities is one of the overarching issues that we are studying at the Connecticut Health Foundation, and how do we, as a society, make sure that once people do have access to our healthcare system, that everyone is receiving the same quality care. I would like to offer the foundation as a resource. We would be happy to, in conjunction with my fellow foundation colleagues and others around the table, conduct some research that might be helpful to this body. We pride ourselves in kind of nonpartisan research, conducting research from experts around the country. One thing I think I also caution you is the federal government is going to be changing the Medicaid program, as everyone knows, in September, and I think we need to keep an eye on that because that could have a huge impact on things here in Connecticut. Thank you.
I'm Evelyn Barnum. I'm the Executive Director of the Association of Federally Qualified Health Centers in Connecticut, and there are 13 centers now operating at 86 sites. And we care for about 250,000 individual patients in Connecticut, and a full quarter, 25% of all the Medicaid patients, and growing numbers, especially over the last 3 or 4 years, of uninsured patients. So I think I offer the health centers up as sort of the canary in the coal mine for anything that you're considering, because they operate on such small margins that they register immediately, you know, what impact on the safety net some of the changes that are already occurring have had, and any that you might contemplate. We're here to tell you what kind of effect that's going to have on those populations of focus.
Good morning, Speaker. Thank you for inviting me. I'm Christine Bianchi. I'm a project director for the Healthy Start program, and that's run out of Staywell Health Center. I feel like I'm on a little chain here because I also am a project director for an oral health project with the Connecticut Health Foundation, and we also have a school-based health center, so I'm appropriately sandwiched here. But with all that experience, what I'm concerned about today is the systems that we create that really require advocates to work with families for a variety of reasons. I think we created systems that are difficult to navigate. I think families themselves may have individual barriers that make it difficult to handle the maze. And so I think it's important that we have an infrastructure of advocates that can work with system administration in getting families the services that they need. And I think your story regarding the child who needs oral health care is just the prime example of that. Hopefully I have an opportunity to talk about some of the things that have been successful in the Waterbury community as on a community-based level. I think bridging all of these different initiatives together for families rather than sending them to 15 different places or having access from 15 different points of entry has been important and successful, and I'd be happy to share some of those experiences. Thank you.
My name is Debbie Puerio. I'm a nurse practitioner. I'm the director of the East Hartford School-Based Health Center program, and I'm here representing the Connecticut Association of School-Based Health Centers. We currently have 62 school-based health centers that are funded primarily by the Department of Public Health in 20 communities. We service about 70,000 children per year through our school-based health centers. We have a national model that includes behavioral health, oral health, and physical health services in a location on school's premises. I think probably the best description I can give of school-based health centers is our motto is healthy kids make better learners. Our goal is basically to focus on increasing children's physical, oral health, and mental health abilities so that they're better integrated into the schools and better able to learn. So we work with schools, families, community resources, we refer out, and I think my excitement in being asked to this board with all of these very important and prestigious people is the excitement that these children are finally going to get the attention and the services, hopefully, that they need desperately. So we would be very happy through the Connecticut Association of School-Based Health Centers to present our national model to you at any point in time, and are thrilled to offer whatever expertise we have. Thank you.
Hi, I'm Rob Zavosky. I represent the Academy of Pediatrics in Connecticut and our over 600 members. I guess I'm on the right side of the building because I'm also the medical director of a community health center about 5 blocks from here in Hartford. I think it was Lincoln who said that God must like poor people because he made so many of them. Unfortunately, Connecticut's probably not as forgiving as God has been about poor people. It's a very expensive place to live. The average salary of a minimum wage worker quickly goes away once they pay their rent. About 2/3 of it's gone right there. If they need to feed their family, that pretty much exhausts everything else. Plus, health care, et cetera, is luxury. Kids are very cheap to give health care to. Primary care for children is very inexpensive. For every dollar that Medicaid spends per child, spends $9 on adult care. Health care is very expensive not to provide to children. Speaker Amann's example of a 6-year-old child probably needed some very expensive dental work. It was even more expensive because he got it in an emergency department. But a simple tooth cleaning by a dental hygienist a year or two before that would have cost literally nickels. Primary care is available in Connecticut for children. It is, whether they're insured or not. As Ms. Barnum said early on, the community health centers are available around the states to provide that care. The community health centers, though, in contrast, are not very well themselves. They're financially strapped, they're having trouble making ends meet, and to be able to get by, they're going to need some help too. The hospitals are not much better off. Although primary care is available for kids in Connecticut, specialty care and subspecialty care is not. Mental health services are few and far between. Dental care is few and far between. It's very hard to find a child neurologist in Connecticut right now. Their average age right now is 55, so in another 5 to 10 years, there are not going to be any. There are many reasons for that, payment being one. The pediatricians are thrilled to be here, and we will do everything we can to support this effort. Thank you.
Speaker Amann, pleasure to be here. My name is Liz Brown. I work for the Connecticut Commission on Children, and we're really committed to advancing public policy on behalf of children and families, and I've had the pleasure to work with a lot of people in this room over the course of my career, and have identified some really big systems issues that the state has played a leadership role, and I look forward to bringing that systems approach to this work, and we have done some really good things, and I echo what Representative Sayers said in terms of we really have some wonderful programs and systems in Connecticut, but we really have failed to have an overarching vision of prevention and early intervention. So I really echo what Dr. Lee had said in his remarks. And we know what works in Connecticut, and I look forward to kind of highlighting them and seeing if we can't change the paradigm so that we invest in them. So I look forward to working with you all, and this is very exciting. Thank you very much.
Good afternoon, Speaker. I'm Karen Snyder from DCF. Children and families are our business, so I appreciate you inviting us to join in this public policy initiative. The healthcare needs, and especially the special healthcare needs of children that are served by our department, are a priority for us. We have a strong interest in participating and being a resource to you. Just a couple of pieces of information. 66% of the inpatient hospital admissions for DCF youngsters are for mental health reasons. 41% of all healthcare visits of DCF youngsters are for mental health reasons. Prevention, early intervention are really important pieces of the healthcare continuum for our youngsters. It's not uncommon for youngsters to come to us with unmet healthcare needs. Almost all youngsters with us have specialized mental health needs. So I support this effort and welcome the opportunity to participate. Thank you.
Hi, my name is Mike Starkowski. I'm the Deputy Commissioner at Department of Social Services. I was happy to hear some of the positive remarks about the programs we operate at DSS, whether they be for the elderly in the ConPACE program or the Husky program for either Husky A or Husky B. I think we've done an admirable job throughout the years. I have a personal affiliation with the Husky program, having been here since the inception of the Husky program, and actually quite a few years before that, too. You know, at DSS, we provide some type of health insurance for about 1 in every 7 Connecticut residents, whether that be through the ConPACE program, through drug assistance, through the KDAP program for AIDS drug assistance, our home care program, Husky A, Husky B, Katie Beckett waiver. I could probably list the 14 different programs. But we actually provide some type of health care or some health care service to about 500,000 people in the state of Connecticut. Just the Husky program alone, we actually serve about 340,000 people in the state of Connecticut. That number has grown exponentially since 1999. In the Husky program, we've gone up about 30% since 1999. We're always happy to work with groups to try to make the programs better, to try to make our programs more accessible, to try to ease the enrollment process, to try to ease the process of getting the services when you need the services. On the other hand, at DSS too, you should know we have about a $4.3 billion budget. It's the largest single general fund budget in the state of Connecticut, and we spend over $3 billion of those dollars on health care. So we're always glad to have people express some positive and some constructive criticism on how to spend those dollars better. And we're happy to work with people to try to see if we can make our programs even better than they are today. Thank you.
Good afternoon. I'm Christine Vogel. I'm the Commissioner of the Office of Healthcare Access. I too thank you for the invitation. The Office of Healthcare Access, among many other things, has a research and planning section of our agency that is receiving federal funding, where we're the ones who are doing a lot of the surveys. I see our data's been used throughout this presentation. And I'm here today to the extent that Office of Healthcare Access can help with any research or data analysis needs of the group. Also, we just have great interest in trying to provide affordable access to health insurance for our citizens. Thank you.
I'm State Controller Nancy Wyman, and most people want to know why I am here. I do procure health care for 188,000 people in this state. Those are the state employees, their families, the retirees and their families. Plus, we have our own program of MIHIP, which is called the Municipal Employees Health Insurance Program, that we've tried to reach out to get to use the power of our purchasing so that we can help address some of the needs of people out there, such as some of our towns, small businesses, not-for-profits, to be able to procure health care. I'm hoping, and I'm just going to put this in there, that as we find this solution for the uninsured child, that we also look to the solution of the uninsured parents. If we don't get our parents insured, it's not as easy to get that child to have that health care coverage too. So I would hope that, Mr. Speaker, we can also broaden a little bit more of what we are doing to include those of uninsured workers and parents. Thank you.
Good afternoon. Now, excuse me. My name is Peter Villano, and I'm the co-chair of the Human Services Committee. The committee, this is a committee of cognizance for all legislation emanating from DCF and legislation for DSS, Mike Starkowski and the commissioner. So all of it flows through our committee, and we do have a deep interest in the legislation that affects children and health care coverage for children. And I think we've got a good record this year. We won't go over it, but our summary of what the committee did reflects some good work for DCF and the Husky program for DSS. So we're looking forward to, my co-chair and I, Senator Hanley, to the work product of this working committee, so that that part of it that doesn't fall in Peggy Sayers' Public Health Committee will also come to us, because we kind of get a second hit at some legislation that originates in public health and comes to human services. And we're looking forward to all of us to working with you to fulfill the aims of this working group, which is so important. Thank you, James.
Thank you. I'm Peggy Sayers, House Chair of the Public Health Committee. I'm also a nurse. I'm a mother and a grandmother. And so children's health is really important to me. And I'm excited because look around the room and the expertise and the people we have in this room. I think we have an opportunity of really coming up with some excellent ideas, not only to improve our health care to our children, but to make sure that it's quality health care. So I want to thank you all for participating. Especially want to thank the speaker for starting with this group and helping us to go forward with this. And I'm looking forward to what we come out of this committee. Thank you.
Thank you, Denise.
Yes, I'm Denise Merrill, and I'm the gloomy voice of appropriations. And maybe the reality check, I don't know. After having been chair this year and trying very valiantly to balance the budget, I'm aware of sort of two numbers stick in my mind. And one is that, as far as I can tell, this year our health care costs as a state went up about 25%. That's a terrifying number to me. And so we need to get a handle on what's causing the cost. I'm very much looking forward to Juan Figueroa's research. So we're very, very concerned about the escalating cost of health care, not just for children, but for all citizens. It feels like the public sector is trying very hard to step up to the plate to try to bring more uninsured people into our public health systems. And it's difficult. The second number that sort of got my attention just now is something I think we all ought to think about, and that's in the information from the Connecticut Voices for Children, which for many years has done very good research work on this kind of thing. And that number is on page 4, and it says, nearly every currently uninsured child in Connecticut is eligible for Husky coverage. Now, if our purpose here is to make sure that that every uninsured child is insured, we may be halfway there. And I say halfway only because I'm not sure what that means when we hear stories like what Jim and Peggy were talking about, where even with children who are insured, I'm not sure what the quality is or the actual access is to that care. So I think maybe our task goes beyond just looking at whether children are insured as to how the system really is working and what the costs are. I would offer the fact that the Appropriations Committee is forming a group that I think will be relevant to this work on what we call performance-based budgeting, and we're hoping to look at early childhood as a place to find out where we are spending our money now, what kind of access the state at least is getting to care for those children, and how we can make that better. And I really appreciate the speaker bringing this group together, because I think it'll be very valuable to us as a state to figure some of this out collectively, and I look forward to it.
Thank you. I'm State Representative Brian O'Connor, Chair of the Insurance and Real Estate Committee. And as has been stated here before, I'm really excited by the opportunity to try to find a solution for more affordable and accessible health care, focusing on the children, but also, as Comptroller Wyman had said, the families as well. I think the way I look at this, to be successful, we do need a model that is economically or self-sustaining, and one that bridges the gap between the public and private sectors. I think that's one of the key features of this, because one of the things that's going on right now is the drivers of the costs. And I think by putting all these bright minds together, we should hopefully be able to get a handle on that, because we don't want just cost shifts. What we need to do is focusing on taking costs out of the system. And to do that, I think we need to focus on preventative care and also using the existing infrastructure. I think, why reinvent the wheel? We do have some good models out there with the community health centers, also the school-based health clinics, and I hope to be able to add my part to this and to work with everyone. So I thank you, Speaker Amann, for the opportunity.
Good morning, all. I'm Gail Ham. I'm Denise's Subcommittee Chair of Human Services, House Chair. I chair that committee with Senator Prague. So I'm trying to be an optimist. It's hard when you look at what Medicaid costs and how much DCF needs to fund mental health for kids well, you realize how fragmented and how broken our system in Connecticut is. And we have wonderful, wonderful programs that if we could just figure out a way to hook them up together, we really have the makings of a remarkable system for our children. I will continue to stress prevention. I think it's much less expensive, and it's also, it builds trust, it builds relationships for families and kids at the beginning. And I also will make sure that we keep focusing on behavioral health, especially for children and adolescents, because I think that's one of the places in Connecticut that we really have work to do. So thank you, Speaker Amann. This is a large challenge, but those are always the best fun.
Well, first, I'm going to echo everything that everybody has said. We want to thank Speaker for having the vision and the will to do it. As somebody said, there are a lot of conceivable people, but very few achievable. And I read up on his political history. He's an achiever and not just a conceiver. So I have great hope for this committee that he has put together. As he also has mentioned, and many of you said, that I think this is a big topic, and we need to think outside the box. If we look at our own stakeholder, our position, we'll never get there. And somebody also said, vision without execution is a nightmare or a dream. Execution without vision is busy work. And I think hopefully with the leadership of the speaker, we have vision and then ultimately execution. I'm not here representing any organization. I'm representing myself. And the slogan we would like to entertain for our working group is TPIU. Remember that. The patient is you. So if we think that way, as we go through all the gyrations, we'll get the answer. When I was working on the Hillary Clinton's task force at one time, the comment I made at the beginning, just like this, I said, by the end of the Hillary plan, it didn't get anywhere, right, is that if Bill was sick, and he's a common citizen, not a president, and if he could not walk through that system easily with quality care, then it's a terrible system no matter what it is. And we need to focus on that, okay? Now, what are the practical things we hope to be able to achieve? I think we all want here to talk about children's first, and I think we agree on that. We have, from what I understand, with the nurse sitting next to you over there, has already have a good basic system of school-based health clinics. Let's study that, expand on that. Then subsequently, I think we need to break into study group, like the speaker has said, one segment study on mental health, one on dental health, one on physical health, which is medical health, and then report back to the whole group so that we can implement this. We have also studied 7 different industrial countries' healthcare system. They cost about half as what we cost in the United States. The only problem they have is the waiting list in the UK, in Germany, so on and so forth. In the last study that I met with them, I just met with the 7 countries in Alaska to go over this. It is much easier to fix the wait list than to fix the waste and the inefficiency. Listening from our gentleman there for universal health care, from our appropriation chairman and the commissioner on insurance here, there's a lot of wastage. For the healthcare cost to go up 25% in 1 year, that's unacceptable. So where are we going to get the money? The pie is only so big, a pie of money. And the pie, and the need is going to grow larger because we have the baby boomers and we have the more important people getting older, and with the new technology. So we can't squeeze out of that. We can only squeeze out of the wastage and the inefficiency, and there are tons of them, and no stakeholder has a monopoly on that. We have our wastage in doctors, hospitals, insurance company, paperwork. As I mentioned earlier, if you cut 31% of the healthcare dollar that is spent on paperwork by half, by 15%, you can save about $88 billion a year nationwide, and you extrapolate it to that. So there's a lot of opportunity if we work together, TPIU, cut the waste, not cut costs, cut the waste, cut the inefficiency, save that money as an opportunity to cover everybody. And I think one small item you can achieve almost overnight is that the Husky is there, is very good, and I want to thank whoever invented that, but somehow the registration process is not there. So if you make that easy, within months you could achieve that already. Yeah. And there are other to-do things we can talk about later on. Thank you very much, and thank you again, Speaker.
Good afternoon. Thank you for inviting me, Jim, and members of the committee. First, I have to complain that KJ just stole all my material. But truthfully, I'm a physician in practice in Connecticut, and I've been in the healthcare system as a student or trainee or physician for 20-some years. I think one of the things I bring to the committee is I did train in 3 different healthcare systems in the United States, in England, and Canada. And I've seen healthcare delivery and the reception of healthcare from different perspectives, and I think that I can bring some light to that. Unfortunately, I am the doctor of doom and gloom, though, when it comes to the healthcare system. I'm really here because I want to change the entire healthcare system of the United States. And I'm going to start here by working with Jim and start with the children's program. But the reality is we're facing a major crisis in our healthcare system in this country, and it's going to consume us and blow us away probably in about 2 or 3 years. And it has a lot to do with what just KJ said about baby boomers maturing. It has a lot to do with people being irresponsible and not understanding that health care is not an inalienable right. It's not in our constitutions that we have to contribute to it and pay into it. It has to do with our perception of social responsibility and what we're going to do for the less fortunate. And the bottom line is we spend more money in health care than any other country, but we really are not getting our money's worth. And we have a major problem, and I think we have to change our whole focus. And I think it comes with doing everything that we can as people in the healthcare industry. I think we need to educate a lot of people, regular citizens, about their own responsibilities and what healthcare means. I think we have to educate a lot of physicians and doctors and nurses about cost-effective care and not always the latest and greatest care. So there are many things that we can do, and I look forward to working with this committee and starting right here in Connecticut. Thank you very much.
My name's Mary Alice Lee. I'm with Connecticut Voices for Children, and I appreciate being invited to participate in these deliberations. For the past 10 years, first with the Children's Health Council and now with Connecticut Voices for Children, I've been working on monitoring the healthcare delivery in the Husky program. And so I have a good deal of information about how that program works on the ground for families, some ideas on how it can be improved and how we can get more kids in. And I offer those to these deliberations. I see this problem as two-pronged for children. One is that we need to ensure that all of our children are insured. And that will involve things like administrative simplification in the program, about increasing public awareness and making sure that there's community-based outreach. We also need to ensure access to coverage for those children who are in the program. And that'll require some really tough choices around perhaps increasing reimbursement rates for providers, crafting the program in some different ways to increase provider participation and to help families negotiate what is admittedly a very complex system of care for them. It's the same group of people that need to work on both aspects of the program. It's many of the people in this room and others that we've had the privilege to work with over the last 10 years. It's the same philosophical commitment to getting children covered and making sure that they have access to health care. It'll require some different strategies to address both of these aspects of the problem, but I think that everyone here is committed to ensuring that we deliver the best to our children and to their parents, to the entire families in Connecticut that need the health care coverage we can offer them.
My name is Ellen Scalatar. I'm also a senior policy fellow at Connecticut Voices for Children. I work with Mary Alice and others there. At Connecticut Voices for Children, we look at a wide range of issues that affect children and families. Healthcare is certainly one of the most important ones, but we look at many others as well. We do research, policy analysis, education, and advocacy on these many issues, and many of them are intertwined, so that when we look at education, we're also looking at healthcare. When we look at healthcare, we're also looking at the budget. And I think one of the very important challenges ahead of us as a group is to be sure that we are pretty encompassing as we look at these issues, so that we're not faced at the end with something like the budget realities that we haven't taken into account as we talk about this. So I'd like to sort of reemphasize what Representative Merrill has said, and also what Monette Goodrich said from the Connecticut Health Foundation, and that is that the changes at the federal level threaten to have a very serious impact on what we do here in Connecticut. And we can't turn a blind eye to that as we consider what we would like to do and what we can do in the state of Connecticut going forward. Dr. Lee's slogan, TPIU, is very great. And I would like to suggest another one, bringing in sort of the medical side here, and that is do no harm. And as we look at legislative proposals and policy changes over the last few years, I think it would have served us well to look at some of these things to say, well, in terms of children's health and health coverage, are we doing harm or not? And that might be something good to keep in mind as we go forward. Speaker Amann, I want to thank you very much for casting the spotlight on children's health. And I think you made a very important point in noting that Connecticut has been a leader in so many areas over the past years. And in the current fiscal and political atmosphere in which we live, I think Connecticut can once again really stand out and make some important policy and political changes so that we can be a leader in children's health care. This problem is certainly a tough one, but it is not insoluble. And when the Speaker puts his name and his political will behind it, I think that will serve us all very well to really come out with a good, effective product that we can put into practice. So thank you.
Speaker, thank you for the invitation. My name is Kevin Lembo. I'm the Managed Care Ombudsman for the state and soon to be the Healthcare Advocate once October rolls around. I lead a small but scrappy agency that works with patients and their families every day to resolve health insurance problems. Folks will call when they've been denied access, or they feel they're being given the runaround, or they don't understand what's happening in their policy and what they're entitled to and what they're not. We take them through that process. During that, we work to correct errors that we identify in the determinations that are being made by the insurance companies. And we also identify and hope to correct questionable business practices that we identify as well. But frankly, there's nothing more frustrating than taking a family or a patient through that process, getting something approved, only to find out there's nowhere to send them, that there is no practitioner in the network, or there is no resource for them. So we're constantly bumping up against how do you finance something, and bumping up against what is the delivery system and how is it working. And obviously those are so intimately connected, it's hard to sometimes tease out what's going on. Is it the reimbursement, as Dr. Zvosky might suggest, that is driving folks out of networks, or is it something else that we need to figure out? To echo something that Dr. Lee and Dr. Federico were saying, you know, we're number one in expenditures, and according to the World Health Organization, we're number 37 in outcomes in the 2000 study. You know, we're bigger than we need to be. We don't move as much as we need to. You know, all of those things are impacting our health. And there are lessons for us to learn in the systems of other countries. It is irresponsible, I think, of us to look to Canada and say, well, there's a waiting list and therefore that doesn't work. There are pieces of wisdom in those other systems, and I would point us to the French system or the system in the Netherlands, where it isn't a question of do you have a public safety net program or private health insurance, but rather can you have both in the same country and have them work in a complementary or a supplementary kind of way. One final point is that I would echo something that Juan had to say about what are we spending it on. I think there's fear sometimes among advocates that when we identify what we're spending or we realize savings, that those savings will somehow disappear out of the healthcare system and, you know, be patching a road somewhere. I'd like to commit that if we realize savings in healthcare, that we keep it in healthcare and figure out how to get more healthcare to more people. That's up to you guys to figure out how to do that. We're undertaking a study now with the support of the Speaker, with the support of President Don Williams, with the support of the Governor, to look at pharmaceutical purchasing strategically, and I don't know if it's a blessing or a curse that I'm sitting next to Anita, but you know, to figure out what are we spending, how are we spending, is there better ways to spend it? But the advocates and labor and those folks who are supporting us at this point are very concerned that once those savings are realized, they will evaporate. So that said, I'm delighted to be here, happy to help in any way that I can, and put the small resource of our office in support of the process. Thank you.
Thank you, Mr. Speaker. With that introduction, my name is Anita Shepker. I'm counsel for the Pharmaceutical Researchers and Manufacturers of America. We represent the research-based and small biotechnology-based companies across the country. I'm looking forward to being part of this discussion. I would like to say that I'm looking forward to actually working with Kevin. There are a lot of programs that we have that are available that I think people aren't aware of, and I'm looking forward to sharing them with all of you. Thank you.
Hi, my name's Bonnie Stewart, and I'm Vice President with the Connecticut Business and Industry Association. We have approximately 10,000 member companies in the state, the majority of which, probably about 90%, have 50 or fewer employees. Healthcare has become a big issue for our members, increasingly so as the cost of healthcare continues to grow. So a number of the issues that we're concerned with were already raised here today, both not only dollars, but the outcomes is a big issue for us and has been for quite some time. We want to make sure that people get the biggest bang for their buck. In addition to that, the individual responsibility that was raised by Dr. Federico is a big issue for us as well. We want to make sure that the tort system, too, is modified to address those issues as well, so that if someone needs X-ray, they don't get an MRI. So a number of the issues that were raised around here today in terms of quality, dollars, et cetera, are all concerned to CBIA, and we look forward to discussing those with everyone.
My name is Eric George. I'm Associate Counsel with CBIA. I'd like to take the opportunity to thank Speaker Amann